This guy would get nosebleeds every time he performed magic tricks. A few days ago, he was doing a water tank escape act on stage. But as soon as they put him in the tank, he passed out cold. When everyone saw blood pouring out of his mouth, they knew something was seriously wrong. They immediately pulled him out and rushed him to the hospital. The doctors figured it was probably oxygen deprivation, so they scheduled him for an MRI. But the moment he got into the machine, he started screaming about stomach pain. His whole body began thrashing around. The doctors rushed over to check on him. They saw his abdomen was completely blood red. This meant he was bleeding internally. The doctors immediately performed surgery on him. They found multiple tears in his digestive tract. The medical team gave him massive blood transfusions, but they couldn't figure out what was causing the bleeding. That's when House said he wanted to show everyone a magic trick. He went ahead and pulled a key right out of the guy's stomach. Turns out magicians doing underwater escapes always hide keys in their mouths beforehand. But this guy accidentally swallowed the key. When he got the MRI, the powerful magnets yanked the key deeper into his organs. So House figured the guy wasn't actually sick at all. It was just accidental drowning that caused cardiac arrest. But the patient didn't buy that explanation. So he performed a magic trick right there for House. The next second, blood came gushing out of his nose. House immediately had his team examine him. They discovered the guy was bleeding everywhere inside his body. One doctor suspected the blood plasma they'd given him was contaminated, but testing the plasma would take way too long. So House, who had the same blood type as the patient, decided to transfuse that same batch of plasma into himself. He wanted to see if it really was a plasma problem. After the transfusion, House quickly developed a high fever. Then he collapsed on the floor. When the doctors tested him, they didn't find anything wrong. It was just a harmless transfusion reaction. At that point, House's friend criticized him for taking such a reckless risk just because their blood types matched. House suddenly realized something. He immediately asked what the patient's blood type was. It turned out their blood types were completely different. The doctors had been determining blood type based on the patient's antibodies, but the guy had lupus. That condition messes with your antibodies, so the doctors had misidentified his blood type. They'd been giving him the wrong blood all along. Now they just needed to give him saline solution and transfuse blood that actually matched his type.